think we'll go ahead and get going. So many of you know me. For those who don't, my name is Cyrus Worrells, and I'm Director of Programs at the Institute for Spirituality and Health. And just want to welcome you all to tonight's event, Breaking Whole COVID-19, Exploring Spirituality Through Conditions of the Body, or exploring the spiritual dimensions of the coronavirus pandemic, which is part of our larger Breaking Whole, Exploring Spirituality Through Conditions of the Body series. Now, of course, COVID is not like other conditions that we might explore. It has affected all of us. And so it's kind of, as we thought about organizing this program, it's sort of overwhelming to try to consider all of the array of perspectives that we might bring to the table. And we know that's impossible, to hear every story, to have the complete conversation on COVID. I think the complete conversation is the one that began a year ago and is continuing. So the humble attempt tonight is really to explore some particular perspectives that give insight into some of the most poignant spiritual aspects that we've felt in relation to healthcare and the clinic, in relation to faith community, in relation to our personal lives, and sort of the arc of the past year and the spiritual impact and how it's been felt, and how we will continue to feel it. So a few themes, I guess, that I'd like to invite you to consider, that I was sort of brainstorming about or considering in anticipation of the program. And I offer these in humility, knowing that I have been quite privileged during this pandemic to kind of reflect on existential themes. I don't have children. I have a stable job. I am single. I rent. There's a lot of reasons why it's been easier for me than others to consider sort of the broad spiritual themes. But I'm always inclined towards existential thinking, and there's some aspects to COVID that I just want to maybe open the program with. The first one is around this paradox between what it means to be interrupted by something like COVID as a globe and as a species. And we can consider it, the two words that came to mind are trauma and pause. And I've heard COVID be referred to in both lights, that it's a collective trauma that we're all experiencing. It interrupts and disrupts all aspects of life. But in doing so, it also gives us this pause, this break from normal life. And so there's the opportunity for growth. And you consider growth in relation to post-traumatic growth, as well as the growth that comes out of being present to the given moment. So that's kind of one paradox between the trauma and the spaciousness of a pause. Another theme relates to a definition we often use at the Institute for Spirituality and Health for spirituality, which is spirituality as connection. And we talk about our innate ability as human beings to connect with one another, with our environment, with the transcendent mystery that many of us call God, or refer to by many names, and to connect with ourselves. And there's similarly, I think, there's this tension during COVID-19 between connection and disconnection. The disconnection is obvious in the ways that we haven't been able to meet, but the connection has flourished in the way that we, as Laddie put it right before we started, can travel, in the blink of an eye, like we're doing right now, to meet with one another. And it's enabled people from across the world to gather with an ease that wasn't possible before. So, and it's also, I think, allowed us to connect in certain instances more deeply with the people we are able to see, and to value those particular phone calls or one-on-one visits, even if social distanced, with a greater appreciation that brings a greater presence to connection. So, connection and disconnection. I have a few more. I have a number that I could go into, but I tend to wax on in this way. So the one I will point out before we move on with the program is just trust. Trust has been a big theme, and it's shown up in the way how we receive information. When we experience something collectively, we look for an answer. And in many ways, we've seen how different our answers can be. And we've seen how we trust differently. And the tension that comes with a certain requirement of mutual trust, as well as the testing of our trust in one another for a collective responsibility to each other's well-being, and to a sense of a shared point of view. And I think, so considering all of those things, I think while the loss has been immense in terms of life, in terms of opportunities to connect, in terms of, I don't have to go into all of it. We know the loss has been immense, but there's also this opportunity that it has brought to reconsider these big questions about how we connect with one another, what we value most, what we trust and whom we trust, and how to cultivate trust. And I invite that kind of frame of mind and that kind of reflection as we go in and hear the perspectives that we're going to hear tonight, is just an open space of consideration of what have you experienced and what have you learned about yourself and your relationship with others. How has your own spirit been touched by the pandemic and everything that has changed in the past year? So with that, and to all those who are just joining, invite you to open your ears, open your hearts, and be present with yourself for tonight's program. Really happy at the panel we have, and we will be starting. Looks like, Sonja, you're still in the car. So we're gonna start with Ladislaw Robinson, who's a chaplain of 18 years at Ben Taub Hospital and Harris Health. He's bilingual, and so he ministers in particular settings to the Spanish-speaking community, as well as to patients and, of course, the rest of the healthcare team. And he's also the founder and pastor at a small congregation in Northwest Houston, I hope I'm getting that right this time, called Iglesia Bautista Lindale. And so he has both the clinical and pastoral experience to bring to the table. So with that, Laddie, welcome. Thanks for being with us.
Thank you very much, Cyrus. I'm happy to be here.
And so ISH has a rich history of chaplaincy. We were the first nationally accredited chaplaincy training program in the country, but I don't think everyone necessarily knows the role of a chaplain. So maybe you could just give us sort of a brief overview of what your role is.
It's interesting that sometimes people come to the hospital and what they are expecting the chaplain to do sometimes is exactly what the chaplains don't do. And so I remember one occasion I had a patient, and as I visited with her, and we established a very trusting relationship. And she turned to me and she said, "That's what my pastor does then, because he's a chaplain. So now I understand what he's doing at the hospital because I like what you are doing with me." You know, and basically what I was doing was making sure that she was cared for. So chaplaincy is a spiritual offering of care. So we offer care for people, and we are interested in themselves, in them being themselves, just where they are, who they are. It's not my problem to make anybody different from who they are. Exactly where I find them, I walk with them in the hope that when they leave my presence, things will be better for them. There will be an increase of hope. There will be an increase or a reframe of their own faith and their structuring of their trusting relationship, that they may be able to, simple as this, maybe encourage to stay on their medications. So we provide care and support for patients, their family, and the staff in general. That's basically what we do.
Thank you. That's a beautiful summary. Of course, my first question is, how has COVID impacted that process and how you fulfill that role?
I think the situation has caused some, I would say, a bit of tension. And I would say what, as a nurse said it, I am experiencing, the nurse said, a paralyzing fear. I think one of the impact was fear and uncertainty towards the unknown. So then, because all of us were at the same place together, so no one had any advantage over anyone, because we all were facing the same thing at the very same time. But then from the role of the chaplain is to provide spiritual care in the midst of any kind of crisis. And the hospital where I work is a trauma hospital. So things happening at a very fast pace, and we have to provide care and provide a sense of presence that means no non-anxious presence as we care for people and offer them some hope and a sense of assurance as they deal with all their medical struggles.
And are there any particular moments from your experiences of the last year, whether it be at the beginning when it was so new, or throughout that stand out to you?
Yeah, several of them, and let me share some of them too. One of the first thing I remember going into the hospital. I think that was on the 9th of March, was a Monday. And when I got into the hospital, I was on the floor rounding, and one of the directors, nursing directors, said to me, "Chaplain, have you received my email?" I said, "No, I have not received your email." He said, "Well, since you're here, let me tell you. I sent you an email, and I want to ask you if you could come to the units, my units, and just pray at the station with my nurses, because they are nervous, they are worried. And if you would come and pray." I said, "We could go right now and I could do that." Say, "Oh yes, all right." So I went to the nursing station and everybody gathered around. Now, sometimes a place like this is very difficult for people to drop stuff and to come. But I think every single person on the unit, nurses and PCAs, they came and stopped at the station ready for prayer. It was a very impacting moment for me, because I'd never seen everybody at once wanting prayer. I mean, people want prayer, but at once. You go to a group here and then another group here, and then I'm coming a little later, Chaplain, but everybody came at the same time. I think that was impacting to me. And after the prayer, while I was praying, I could hear voices walking through the hallway. And I recognized it was a doctor's voice with some of our residents. And then I would hear footsteps, and then at a certain point, the footsteps stopped and the voices stopped right at the station. My eyes were closed. And as I finished the prayer, I could see some tears in some people's eyes. And the doctor turned to me and said, "Chaplain, would you come to our team, to our office, and pray also for our physicians?" I tell you, it was a very touching invitation, because everybody were together in this very same moment of fear and needing something beyond themselves to hold on to. And people revert to some kind of faith and to some kind of trust in some kind of divinity. And I think that's one thing that I think impacted my own spirituality, to see that people got to a point that they realize, I need help beyond my own forces, and that doesn't come from me, but it comes from above me. And I think that was one situation that caught my attention. Another one was not few days after that, working with patients and working with nurses and working with staff in general and family members on iPad, because no one could come into the hospital to visit their loved ones. And one of the nurses saw me and said, "Chaplain, could you pray for such a nurse? He is leaving us. He is going to another city. And there are a lot of COVID over there, and we are worried about him." And I said, "Yes, you want me to, where is he?" "He's right here." So he answered, and I said, "Come, let's pray together." And again, we gathered in a little group there, and I prayed for him. And at the end of it, again, I could see people brokenness, vulnerability, their sense of commitment to their professionalism, but at the same time, a sense of uncertainty about this situation, not knowing what the future may hold.
What about for yourself personally?
Mm-hmm.
You know, and the uncertainty and wondering what the future may hold. And as you see your patients, as you see your coworkers being challenged, what did you experience spiritually?
It was no different. I think when you are able to see your own vulnerability, when you're able to see your own brokenness, when you're able to relate to your own weaknesses. One of the things when people go to new jobs is a question that is asked is, what are your strengths? I like to ask, what are your weaknesses? Because I think we get to know more about people by their weakness than by their strengths. And you mentioned earlier, Cyrus, that you're single. Well, I'm married. I have no children, but I have a wife at home. And because of her medical condition, I didn't want to cause any kind of infection on her. So I needed for myself to make sure I'm careful. I do everything that is recommended so that I'm not infected and to bring something home. So my own ritual change coming into the house. No entering in the house with the clothes that I come from the hospital with. Mm-hmm. To the clothes go straight into the garage once I enter the garage and close the garage door, and the washing machine is there, and from there straight to the shower before I can greet my wife. And a year has passed, and I think the practice has worked. So I keep on doing the same thing, because since it worked, mm-hmm. I stop it. So
are you able to take off in the same respect I guess the weight of the experiences you have in the day at the clinic? I mean, when you came on, you said, just when we met before this, you said that you had gone into work today to a patient who had passed away. Mm-hmm. When you come home, can you set that aside?
Yeah. Mm-hmm. Yeah. I think it becomes a skill to be able to navigate into all the worlds that I have to move in. And I think it's part of my own pastoral training or preparation, is that right there at the hospital, I am ministering to a mom who has a baby who is jubilant and happy because their baby was born, and they want prayer from the chaplain, and then that's a joy, happiness. Everybody's happy, taking pictures and all of that, happy. But then the next room, it's a fetal demise because the patient lost the child, and this is the third one that they have lost after the several months of pregnancy. So the scene is different, but it's just from one room to the next room. Mm. Then I have to shift gear very quickly to make sure that I do not project on this family a sense of happiness that they are not experiencing, or vice versa, that I don't take the person's sadness into the next room. And so I believe that has become part of my skill to be able to deal with that as with the patient who is going home because they're happy they have a good result from all the diseases that they went through. But then, like this family, they're going home sad because mama is not going home with them. And you just have to navigate that. And I don't know if I can explain how to do it. I just know how to do it. Mm-hmm. don't know if I can explain to you certain common things that we do, but we end up doing them. You know,
Well, I'm curious, Laddie, how that, you mentioned going from room to room,
Mhm.
but in a time when you can't go into the room always,
Yeah. Okay.
does that change that if it's going?
Yes. Yeah.
And do you feel, I guess the question kind of leading to, when you're connecting through an iPad, have you been able to feel like you can enter a patient's room?
Yeah.
And how has that
Yeah.
been?
So let me tell you about this. I think she's 47-year-old or somewhere around there in that neighborhood. And she was a COVID positive patient. And I couldn't go into the room, but I could see her and she could see me from the window. And I stood at her window with the iPad, and she had an iPad in front of her, but she could turn her face and she could look at me through the window, or she could look at me through the iPad, and I could do exactly the same thing. And because her illness was so intense and she was coughing so much because of all the whatever was going on with her lungs, and I stood there for 40 minutes and listening to her agonizing cough. And I just stayed there. And at the end of 45 or 46 minutes, I don't know how long, I was able to get one single statement from her, because every time she would open her mouth, the cough would begin. And one of the things that she said, Chaplain, please pray for me. Chaplain, please pray for me. And I am saying that in one sentence, in one, but it was piece by piece that I was getting that because of the cough. That broke my heart, to see someone and then not able to have a loved one or family or anybody. She is Spanish speaking only, so she cannot communicate with everybody that goes into the room. And it becomes a sense of isolation or loneliness, or a sense of even abandonment. It is really a place of brokenness. And that's exactly what I felt. The brokenness and the important sense that, how do I fix this? Is there anything I can do to fix it? And I'm unable to do it. But to see the suffering, human suffering, if you pay attention to it, it will break your heart.
Wow. Well, I can feel the gravity of that moment. And then I'm thinking that you go from the clinic to then tending for a congregation of parishioners who look to you as their pastor to also make sense of this, and losing their ability to come into their faith home. So I'm wondering if you can you speak to the experience of your congregation and how you've ministered to them in this time?
I'm sure some of them might be right now connected to listen to this, and then switch over to church in a few more minutes, in the next hour or so. But yes, I always tell people, because the question has been asked this way to me: how do you manage to pastor a church and work as a chaplain? And my answer is with another question: how could I be a pastor of a church if I were not committed to chaplaincy ministry? Because I think, as John Stott, the famous British minister would put it. Preaching between two worlds. And I think we always are stuck between two worlds. And here is the world that I call the world of the raw reality. The hospital, where stuff happens, where we see the suffering and the pain and death and dying, as well as healing. And able to come to church to nourish your soul to go back to do the same thing. So I think the church feed me to feed the hospital, and the hospital feeds me to feed the congregation. Because I can be more humane. The suffering of the people in my church. I can be more loving to the people in my church. Because what I feel and what I experience. Henry Newman talks about the wounded healer. How can I minister to a church if I have no sense of human pain? So when you have experienced pain, you can relate to people's pain. It was Naomi Remen who talks about that matching vulnerability that we experience. We can only trust people who have had that kind of, because when you're telling someone, I understand, what is it that you understand? What is it that you understand? My father was murdered when I was 14. And I remember standing in front of a young man whose father died of a heart attack. And he comes into the hospital with his mom and his older sister. And as I was talking to this 14-year-old young boy, and he looked at me and said, "What will I do now?" And I paused for a moment and I said these words to him. I said, "Let me tell you a story. I remember a little boy like you who lost his father because he was murdered." And I went through the whole story. And I said, I know very well that little boy. Would you like me to tell you who that boy is? And he said, yes. I said, he is right in front of you right now. He said to me, "Your father was murdered?" And he reached out and he embraced me. And he said, "The same way you got out of yours, I am going to get out of mine as well." Never saw him again, but I am trusting that something from my own vulnerability, my own brokenness, my own pain was able to reach to his pain, and that matching vulnerability was able to fix what words and everything else could not.
Beautifully said. Thank you, Laddie. And look forward to asking you a few more things in the Q&A. Appreciate your presence with us tonight.
Very good.
With that, going to turn now to Dr. Sonja Sloan, who's close friend and board member at the Institute for Spirituality and Health, and very successful orthopedic physician, who for the last few years, her clinical practice has been in service to the Native Americans living in northeastern, I believe, Arizona and the four corners of those states, the Navajo Nation and other tribes that live in that area. And she also serves as the First Lady to the Luke Church, which is a large congregation in Humble. And so you too bring the perspective both from clinic and faith community. You also have way more awards and have started more initiatives than I could possibly list out in the bio. And I believe your book is for kind of up and coming medical professionals, the rules of medicine, a medical professional's guide for success. So thank you so much for taking the time to be with us.
Thank you. And on behalf of the Institute of Spirituality and Health as a board member, thank you guys for attending tonight. This is a very special webinar, if you will, or Zoom call to speak on these things. And I don't know to call you Pastor Robinson or Bishop Laddie, or I'm not sure what I'm supposed to call you, but your words ministered to me. I trained at Ben Taub, so I know that environment. But being where I met on the Indian reservation also, it's been a tremendous burden. And your words, I echo all of those sentiments, and that in different aspects of how we've had to deal with COVID in our own personal spirituality, and how we had to leave the professional side at the door when it came to the personal side. And that interwoven spirituality has been a challenge. It has been a burden. And I think in the debriefing, as we are trying to see a light at the end of the tunnel here, I think we as frontline workers and even the people that have just been through this trauma, we're going to have a way to decompress, because just listening to someone else talk about it was triggering for me to tears, because I think I suppressed a lot of the things that I have seen and the things that I have experienced that I don't share, because unless you're medical, you may not understand. And then, like you said, I live in multiple worlds. I'm on the Indian reservation. I'm mom to 3 kids who were homeschooled and virtual for a while. And so that was very difficult, and watching my kids become depressed. I'm a first lady of a mega church here on the north side of Houston, and watching my husband literally, if you haven't seen his video under Pastor Timothy Sloan, went viral to the point where he was just discussing how he could not minister and be present for a 26-year-old who was dying of breast cancer because he was not able to get to her in time because of all of the, things, the barriers for a pastor at this point to even minister to their own congregants, so to see that type of transparency, to try to minister on that side, dealing with death every week. We have dealt with it. It's phone calls, it's home visits from outside. It's, I can't hug you, but I want to, it's me being careful because, like you said, I have to undress when I get home. Well, because I travel, all suitcases stay outside. So when I come home, nothing goes in the house. I've been tested 14 times for COVID because every time I leave the hospital, I get 2 tests, to make sure I don't bring it home. So those things, to make sure that we're keeping everybody else safe and still functioning professionally, there is a spiritual realm that you have to be strong in to survive this far. And so I think we as a world, as a global society, are better because it was a trial, a tribulation that we had to live through and that we still are living through. And a lot of the ramifications of 500,000 people dead, in the United States, and families wiped out, generations, so we have not seen the ramifications of all of this quite yet, and definitely not to the spirituality of who we are yet.
Where do you, in holding all of that, where do you find the strength? Where do you find nourishment and lift?
Part of the lift is still serving. I'm a servant at heart. I'm a servant at spirit. And that I know that if God has put me here, it's not to fix broken people, literally, physically, orthopedic wise. I put broken bones back together again. It's part of the broken spirit. and healing someone. And sometimes it's not always that you can fix it. I don't think I told you about this, Cyrus, the other day. Was a patient on the Navajo Nation. She was admitted. She was a kidney transplant patient, which means we have to be a lot more vigilant about what's going on with them. And she was already a COVID survivor. So they were just making sure that she didn't go into renal failure because of her transplant. But in that moment, her mother was positive and they had sent her home to die. And so hospice was at her home and she could not go home because she was a renal transplant patient. And because she'd already survived, could not be exposed again with the idea of, what was going on. So she couldn't be there when her mother passed away. But in that moment, it was, can I pray with you? I've operated on your hand. I've done surgery on your hand. I've taken care of you as my patient. But now can I be, in a spiritual light of support to you? Because I don't know what else to do for you, but to pray and then be in her world. And in her world, prayer was what it was. She needed someone to hold her hand and pray to her God with her in support. And I did that. And what I love in this moment was sometimes God will show up and just surprise you. And it's that element that keeps you going. At the end of the prayer, I asked her what her mother's name was. Her mother's name was Brenda. So I said, yes, ma'am, I will be praying for Miss Brenda. I will have our church, Miss Brenda, on our prayer list for our prayer warriors to pray for her. And as I was walking out, the shift change came on. And because there's so many traveling doctors and so many traveling nurses, you don't know everyone. A lot of people are new, never met before, that kind of thing in the hospital. It's a different group of people now taken care of because of the need. And she walks in and she says, hi, I'm the shift nurse. My name is Brenda, and I'm here to take care of you. And we both just were like, God will send you what you need. Even in the event, it may not be to fix her mother, that to save her from death, but he sent a first lady from Houston, Texas, to a Navajo Nation just that week that she happened to be in the hospital to operate on her, to pray with her and to comfort her. And then God sent a woman who just happened to be named Brenda at the moment that we were talking about her mother and praying for her. So it's those, uncanny moments that God shows up and still affirms that, I may not do everything that you want, but the presence of God is there. And I think even as a people right now, a lot of times it was just about being present. And it doesn't mean that I have to be sitting right next to you or in the bed. It's sitting there listening to people. It's checking on people. It's, the texting to say, how are you doing? It's being concerned past just a hello or hey. It's, how is your mindset right now? Are you depressed? Are you eating? Are you exercising? All of those things. Because I think the power of presence right now has yielded more comfort than anything else, and presence in different ways that we've never had before.
Wow. I'm struck by this common prayer that you were able to pray with. Was she a member of the Navajo Nation?
She is. And so with the Navajo, their tribal beliefs are different, but I think there is definitely some influence of Christianity there as well, on the reservation, as well as Muslim. So there are other faiths that are there that have influenced some of them, but deep to their core, they're still very Navajo tribal religious beliefs and customs,
Yeah.
And for her,
I was just going to say, can you say a bit more about how the local custom and belief system has impacted the community's response to the pandemic?
For the Navajo, yeah, they have they're very superstitious. They're very, they don't believe or trust very well outsiders. Let's just say that, as to be expected, right? So unless you're a regular doctor there or a regular nurse there, they are not real trustworthy. They don't trust you, and so their fear factor of COVID and what they call a dark presence or a dark spirit, is well beyond what we have dealt with in civilian world, and what I call, civilian world of America versus the Navajo Nation, this little, group of, large group of people. So they do not just take your word for it, and I take care of the Navajo, the Zuni, the Hopi, the Como, the Chinle, and there's a couple of Apache. Sometimes they come from Arizona to come through Indian Health Services. So it's a huge gamut of different tribal beliefs, and they don't all believe and get along, and they have different beliefs in that sense too. But what is a common thread is that COVID was a foreshadowing, like their forefathers had told them that this was coming. So they were not necessarily surprised, but their fear was on a level that I can't explain to you, and it was tangible when you were there. But it led to more and more mortalities, because they're not coming in to be tested. The hospital was a bad spirit place for them. They saw all the death there, which was a dark spirit versus a light spirit, which releases these things. Their medicine man, there's two types of medicine men. They have a medicine man that is on the hospital property that deals with the black or the dark spirits. So that's death, that's miscarriages, that's cancer, that's illnesses that can't be fixed. And then there's a light spirit medicine man that does deal with orthopedics, like broken bones. Like they actually manipulate. They're called manipulators. And so what I would actually do in surgery or whatever else, they do tangibly with, physically praying and meditating and their chants to mold the bone back, and that kind of thing. So different beliefs, and you have to respect that. But with COVID, it devastated that population, 20 to 30% mortality if they got COVID, young and old. And within the household, their household is a hogan. Hogan is like a 8-sided house, if you will. And in the center is a stove chimney kind of thing, and very small. Most did not have running water on the reservation. So therefore it did make sense for them to wash their hands for 20 to 30 seconds. They didn't have the water to wash their hands. So therefore more of them got COVID. Multi-generational household. So if grandmother got it because she's more susceptible, guess what? Daughter and son got it, and now grandchild got it as well. It wiped out whole families, generations of families. So in that sense, they were terrified, they were devastated. Even with the vaccine coming in, they were very leery, especially even within the African-American community, I could identify because of the mistrust of medicine when it comes to different racial cultures, and Navajo or the Indians were one of those. So it's been a trying time and a different level of dealing with COVID with this population. A very disheartening for a population that was already very indigent and really, poor and had nothing already. And so now as they're coming out of this and starting to open back up, New Mexico is starting to open back up. It's night and day. I leave Texas. Texas is open. It's a party here, It is a party. Airports are packed. You get to New Mexico, like April, May, I'd get off the plane and, it was like martial law. You were met by the National Guard. There was no cops. There was no airport security. There was no Homeland Security. It was National Guard, and they asked you where you were going and who you were seeing and how long you were going to stay, and have you had a COVID test, and all this other stuff. And then I would get on the highway, 2-hour drive from Albuquerque to the Navajo reservation, never pass a car, pass lots of trucks, because at that time, April and May, they were trying to get merchandise out, right? We were trying to get toilet paper, we were trying to get paper towels and all this other stuff. So lots of trucks, but society as a whole had shut down. And now I think it's a anxiety as we open back up, and we're swinging the pendulum the other way to something that is so tangible that is almost bad, in the sense of that people are antsy, and now we can't wait anymore, and people aren't nice and friendly and patient anymore. It's like we've swung the opposite direction. So it's one I'm sort of concerned about,
You touched on something I'd like maybe to ask you further about is the mistrust around, and you're touching on that theme of trust, especially around medicine and around
Yeah.
science and who it serves. And I'm curious, how has your congregation, the congregation of the Loop Church, looked to your husband and then to you as a physician
Yeah.
on issues like the vaccine and on masks and on how to behave in this time?
So this Sunday is the first Sunday we're going back to church after a year and a month. And we did a lottery, basically, would be the 500 to be able to get in for one service on Sunday. The website crashed twice. People want to be back in the house of the Lord. They want to be back in the presence of other believers. They need that camaraderie, that support, that network. But you also have several that are like, I'm not coming back. I don't trust other people who may not wear their mask or who may be positive and they don't care that they're going to give it to someone else. So the faith community, as far as African-American faith community, is split. You have some, I've gotten the vaccine because I'm a doctor, I'm on the forefront, and I've got to be safe to bring stuff home to my family, but I questioned it. I definitely questioned it. I looked at the research. I, looked at all the data, looked at the historical medical apartheid in the United States when it comes to African Americans and Navajo and other Indians. And I was leery. I was very leery. And so, that my husband was one of the first African American ministers to interview Dr. Fauci, dealing with COVID in the Black church and specifically with the vaccine. And what came out of it was really people just wanted information. People need to know not just the awareness, but they want to know all of this is out there and they don't know what to trust. And because everything has fluctuated and gone back and forth, that allows for more distrust, the miscommunication. So I think with hearing it directly from Dr. Fauci, it was very informative. It helped a lot of people decide they wanted the vaccine. But it definitely still lends to, you have about 30% of our population that do not trust and do not want the vaccine. And I don't believe, even with information, that you're going to change their minds. It's just a different mindset. Same with the Navajo were offered the vaccine in December as soon as it came out. They were the first ones, and there was no hierarchy. So kids got it, parents got it, grandparents got it, everyone got it immediately, so that was a difference than what we see in the civilian land here. But even with that, a lot of them are like, I don't trust medicine, so I'm going to wait, but you have to outweigh the good with the bad. And that's where I tell my people, when they're asking, do your homework, do your own research, talk to your doctor, talk to other people, and come to your own consensus so you can be comfortable with getting the vaccine,
So many different kind of themes, communal and spiritual. Thank you so much, and more to come in the Q&A.
Yeah.
And now we'll turn to you, Constance. Constance White is, let me change the spotlight here. Constance is a good friend as well of myself and of the Institute, and was one of the first to be diagnosed in Houston. She was diagnosed when there were only 50 reported cases with COVID, back when not much was known about it, and has a rich story to share around her experiences since then. Really happy to have you, Constance, and have your warmth and presence with us tonight. So maybe we can start just by going back to now over a year ago. I think you said it was March 13th, 2020, when you were diagnosed. So can you take us back to that moment and that point in time for all of us, but also particularly for you?
Mm-hmm. Thanks, Cyrus. And I just want to thank Reverend Dr. Robinson and Dr. Sloan for their comments. I'll go into a little bit, but I had a really great experience at Houston Methodist Hospital as a donor of my convalescent plasma for COVID-19. And so I really appreciate all you do, and thank you. And Dr. Sloan, I'm from New Mexico, and I had a wonderful opportunity to spend some time out there in quarantine with my sister and brother-in-law and nephew for the first time, and then subsequently we went out later. And yes, it was hard to see Santa Fe area shut down. I drove out there, and so I saw very few cars driving and very few police officers. So I didn't experience the same thing you did in the airport, but it must have been really something. So thanks for all your work with the Navajo. So Cyrus had mentioned I was tested positive early, and that's correct. I believe my first symptom was probably on March 13th, 2020. That was the week that the Houston Rodeo shut down. I was expecting friends to come. My sister and brother-in-law had a small group gathering at their home for dinner, and in the middle of the dinner, I just became very cold and just very tired. And so that weekend, I just kind of took off and canceled some plans. And the next week, our offices were voluntarily open. They asked us to stay home. This was just all when kind of the COVID thing was just starting to be discussed. I developed some symptoms pretty strongly, exposed family and friends and colleagues to COVID because at that point I didn't know just yet that I was going to test positive the following week. So I do live alone, and so I just felt really, really awful. And so I drove myself to the Houston Methodist Clinic near my house, and the doctor there who was on duty just had no doubt I was going to test positive. And so if you all recall, there were a shortage of tests during that time. And so, of course, me being, in denial, I just said, just save this test for someone else. And he quickly just said, I feel good about this. You're going to test positive. So I did. And I had my chart at Methodist, and I checked it, and coronavirus said negative, influenza was negative. So I just remember calling my sister saying, oh, I'm negative, yay. And then that evening I received a phone call that I was positive with COVID-19, which is when I learned that COVID-19 is just another coronavirus, and I did not know that. So I developed a lot of symptoms. I was home, and there's no cure for COVID, so you do what you need to do. And I just remember the last thing the physician at Methodist just told me is if you have any harder time breathing, take yourself directly to the hospital, downtown, not back to the clinic. So that was kind of the start of it. And I'll kind of mention my front yard oak tree. This is the season when they shed, and one of my symptoms was a really, really bad backache. And I thought it was just because at this time last year I was raking leaves. And just fast forward, just a week ago, I was raking those same leaves from the oak tree. And so we can talk about that a little bit later if we have just the symbolism I felt during the 2021 time. So the outpouring of love from my family and friends was something I'll never forget. I reached into my tool chest of what I need to do to kind of just work through this, what I call loneliness, but not being alone, and just got a lot of phone calls and text messages. And to your point about just the power of presence, is I felt that a lot just with my family members and dear friends from across the states.
It must have been really scary at that time with so little information about it. I mean, what did you go through internally in terms of the risks and what this meant and how to convey it to people? What was going on inwardly?
Well, when I got the call, I won't lie, it was very scary, because then you just heard so many reports of it was just horrible if you're going to get COVID. And I still don't know where I got it. I don't know anyone in my family or friend circle or people that I was connected with in the last, the week prior to that got COVID. But it was scary. I will say just recently, just in talking to different family members, specifically my nephew, I asked him what it was like for him to hear that his aunt had COVID so early on. And, you know, it was a very intimate conversation, really dear nephew of mine. And he was really scared and let me know that, oh my gosh, could this be the end of Aunt Conky? And that was really emotional for both of us to even have that conversation. But I'm just really grateful for my health. I think that my family strength and support for one another is just beyond what I can even imagine in a family. And so I think that has a lot to do with how I approached it. I think that my dear friends and friends that I haven't heard from in so long who texted me or called me, my nephew serenaded me every day. I had another niece and two nieces actually that called me a lot that week, and my other nephew out in New Mexico, and my nephew in Atlanta, you know, engaged me in yoga about a week later, and I realized how weak my body had become because I just couldn't even get through a 30-minute yoga with him. And so I think that there are just a lot of realizations that were pretty powerful, and I look back on it now and I'm just really grateful so many families just had such a big loss during this time. So anyway, I can't thank my friends and family enough for their support. And I think prayer is just huge. One of the things, Cyrus, that you and I talked about is one of my spiritual practices today is journaling every day. And there are days I miss, but mostly I do journal a word or 2 pages worth every day. And so I started a journal. And I started it just about a week after COVID, and I'm going to read what I wrote on 3/29, which was just a week after I was tested positive. And so there's a few journal entries in here that I go back to, and actually I took this afternoon just to kind of look through this journal, and it really brought back some memories of that week and of this, but this is what I entered. I'm ready to journal about this experience of being tested for COVID-19 a week ago. This has been life-changing for the world and for me personally. For the first time, other than 7 hours of solitude on a mountainside in Colorado with my American Leadership Forum class, I've been isolated with my thoughts and with my sweet puppy Becky. Thank you, Lord, for Becky. I am digging deep and I'm at peace for what is to come. I am on a downhill side of my recovery, and while I cannot be vain enough to say I am blessed, I do know that I am fortunate for the support from my loving family and friends. The best of others shines, and I feel the love and prayers. So that was my entry, and every day I journaled, and that was what I did. The other practice I did, and Jenna Davis is on this call, and she is a friend and the founder of Yoga Mass and part of the Institute of Spirituality and Health Family. And she introduced me to Yoga Mass and Cyrus and Stuart and, different people. But she developed these yoga cards. And I called Jenna and I said, how can I work in these yoga cards through this healing practice of my COVID? And she was really helpful, but she developed these cards. They're called yoga prayer cards. And each card has a position on it. It talks about the spiritual practice of it. And so throughout my journaling that year, I entered, the yoga cards into my journal. So I'm going to read one from this. And Jenna, I hope you are listening, and I hope you appreciate it. And I look forward to talking with you offline about this. But this was on March 30th. So just almost a couple of weeks after. And it was a card that's called Extended Side Angle Pose. And what the card says is, as I stretch alongside my body toward the heavens, I am inwardly focused on my desire for wholeness. My breath helps me remember divine spirit is with me and within me. In this moment, I am whole. And what I wrote is today's blindly selected prayer card, yet another perfect selection, Extended Side Angle Pose. The words matter, and I am aware of the divine presence within me. The many calls, emails, texts, offerings is divine presence. I have looked inward and prayed for healing and wholeness. My breathing during COVID-19 has improved, and I give thanks to the divine. My desire to be closer to the divine is present. I feel the stretch. I am reminded of a heart, healthy spirit, and I am grateful. So that was my entry in my journal. And I had another friend call me, and she was wanting to have my sister and mother's phone number, and I told her I wouldn't give it to her, and jokingly. And later I was on I call it the Conky COVID Compassion road trip, and she later told me that same week 2 of her friends had died of COVID. So I think it just brings it back that, this COVID is very serious, and it treats everyone differently. And it's just something that I think we're all going to learn from. And like Dr. Sloan, you say, I think we just haven't seen really the outcomes of a lot of spirituality and a lot of long hauler symptoms, especially what's happening with our youth.
Well, thank you for your vulnerability and sharing the journal entry. That's so beautiful. And I know also, like, as we talked, we talked about the whole arc of this past year and kind of your process of facing the fear and uncertainty of that we all in some way, not directly like you, but kind of felt in that initial stage. But then as you recovered, you found ways to kind of give back, I guess. And can you talk about those, both the experience of giving plasma as well as that road trip that you took?
Yeah. Well, after I was cleared of COVID and I started giving my plasma, which I'll touch on, another life event happened, and I had a change in my career, which was let me know that I was going to be leaving that after 38 years. And so that was kind of a heavy weight, but again, it's okay. And we all have, different changes in our life. I think that it put in perspective a lot of things. I had friends who lost a sister tragically, a son tragically during the last year. Just parents that were of loved ones, and we're all just so collectively in grief with one another, but also so supportive to one another. So when I was getting the news that a lot of things were changing in my life, I just remember sitting at my kitchen table and thinking, I can work remotely from my kitchen table. I can work remotely somewhere else. So I decided to call some friends that live along the way that I was in college with in the South, and decided to take a road trip. And what turned in 10 days turned into 21. And what I didn't realize that trip was, initiated so self-serving. But what happened was my friends had been in quarantine for 2 to 3 months, and here comes a friend that they could hug without being in fear of getting COVID. I could hug them, which, hugs were far and few between. And so it was just really that's why I call it my compassion road trip, is not only was it a gift I received from being on the road trip and being with friends and there, but it was a gift I gave to them as we could hug, and I was safe. But I think the most valuable giving I did was, well, it's kind of the same, but it's just different, is because I went to Methodist reached out to me to be part of their convalescent serum plasma serum therapy program. And Dr. Salazar is one of the leading researchers in the United States. And it was just 2 weeks before I first went into Methodist to give my plasma, they had actually administered that had the approval to administer their first antibody plasma convalescent serum to a patient. So I went in, was tested, had high level of antibodies. And so I was fortunate to be able to be what they refer to as a serial donor. And I was able to donate I visited 15 times and probably it was successful 12 times. And what I was told by the Dr. Salazar and his team is that while my plasma may not work, on you, it may work on someone else. And I would never know who those people are, but I was told that, my gift of my plasma was saving lives. And so that's really, it's really meaningful. And so I found just a lot of meaning in going up to Methodist and having the relationship that I still have today with Dr. Salazar's staff. And hopefully, they're encouraging me to get the vaccine, but I'm going to go in next week and just after a year and just see where my antibodies are. And I think it's kind of interesting to me, and I think interesting to them as researchers is, where I stand. So it's a true gift to give, and I receive a lot back from that. There's a story that I heard that I'll never forget. Is the first time I was giving my plasma, it was in an upper floor of Methodist that looked across to another Methodist building. And they had told me about a woman who husband was in the hospital, just really severely bad case of COVID. And she was giving her plasma antibodies, and she just would look outside the window, and she felt that was the closest that she could get to her husband. And it was just really sad to think about that she just couldn't be with her loved one that she'd been married to for so long. And I'll just never forget that story. And there were many more, but I met a lot of incredible people, all ages, giving their plasma. And it was, I think, a reason I had COVID is because I was able to give so much. And so I appreciate that.
So, I know there's a lot more you could share about your story in the last year, but maybe just coming full circle, being back in March, it's the same season. How are you feeling? Are you still journaling, and how is it now, even as you go through this process of thinking about your remarks for tonight to reflect on the last year?
Yeah. Well, it's interesting, I look for symbol and dreams and such, but I was mentioned the oak tree in front of my yard, and the oak tree is symbolic of something very mighty, and it sheds its leaves, and it's a mess. And so this time last year, I got a really bad backache, like I mentioned earlier, but this time it was time to rake those leaves again. And it was a spiritual practice for me. I spent probably 3 hours, and I just reflected on the last year of all the different events and what this country's gone through, and just the divide in so many levels. And but also just this heartbreak, but the positive humanity that's come out of this. But I just was just so grateful in that practice. And I really thought about the old oak tree and how, it sheds, but within a couple days you see the fresh new life. And that's, I think that's really symbolic of what we're going through this spring. The point that the other guests have talked about of just, the resilience that we all have. And in my career, I worked with helping different at-risk kids. And so I feel like I have a view of what was going on in the community. And a dear friend that works for the YMCA, they couldn't accept volunteers because of COVID restrictions. So their staff was worked overtime to help with food distributions and the needs of the families at the YMCA. And you hear about schools that were closed and the food insecurities and how that was, happened to, just bring the best out of people, and that it was just so challenging. And, I worked with a group that supports handicapped kids, and they get their their bedding and their diapers and, so important supplies like that through their organizations that they go to every day, and they couldn't get those. And so that was a challenge. And, the internet for inner city schools, and that was a challenge. And, now there's a challenge of the kids that have the first time have their own computers at home. And so internet crimes against children have gone up more than 90% since last March, because kids are at home for the first time with the freedom of chat rooms. And there's so much, but there's so many heroes and so many people that are really helping on the front lines, from our two speakers to the people I've met at Methodist, to my friends, my family and my friends that are volunteering. And I think it's like sort of like post 9/11, you see this country coming together when it's so important. And unfortunately, it kind of slides down a little bit. But I think that if we can all just remember that we're all in this together, and the humanity is so important, and just the positive, just everyone just can help do their part. And we really are, we are really good people, and we're there for each other.
What a beautiful closing sentiment. Thank you, Constance. Thank you for sharing of yourself and the year that you've had. I think we'll have a little time for questions. We have about 10 minutes left. So maybe a couple questions. Please go ahead and put your questions in the chat and indicate who it's for. But while you're doing that, I'm going to take the liberty of asking a question that I want to ask, and for all of you. But I think Laddie will start with you with this one, which is just the question that we often talk about in the relationship between spirituality and health, of how health and illness, individually, socially, can challenge and transform our spiritual lives. It can make us question our spiritual orientation and beliefs. And a classic question people ask is why? Why, God? Would this happen? Why would it happen to me? Why would it happen to my family? Why would it happen to us? And so I'm curious your answers to that question, both individually and as you've been asked to answer it for others. So Laddie, we start with you.
Yeah, why? Why is a very intriguing question. And from the perspective of different people, the intentionality of the question sometimes is not so much to find an answer to the question, but to invalidate the person to whom the question is being addressed. And so if the question is to find an answer, which is what I would focus on, why me? I remember a preacher responding to the question by saying, well, why not me? What is so special about me that not me? But I think when it comes to suffering, when it comes to pain, I don't know if we have some kind of information that we do not deserve certain things, or we deserve some other things. And we may have made up some kind of responses to define our humanity and therefore whatever we have defined, and the question doesn't go to that definition, then it's a risky thing. And but I think to ask the question is legitimate. To ask the question why, I do not know if we are going to get a satisfying answer to the question, because I don't think there is necessarily one to it. And from my point of view, whenever I am faced by this kind of question, I like to ask people, what is it about you that you think you should not face this kind of situation? I personally believe in my own life, I don't know where God will lead me from this point. I do not know what the future holds for me. I have no earthly idea. But I am totally convinced, beyond a shadow of a doubt, that I just pray to God that whatever is out there for me, that I do not, in none of my action, in none of my behavior, bring any kind of shame to his name. I think suffering will cause us to ask many questions. And some of the questions that we will ask, among them is the why. We may have some kind of answer. Sometimes it will be a silence. And sometimes we will have to learn to live with the silence of not having an answer.
Thank you, Laddie. Constance, how about you?
So your question in a nutshell then is why me?
Why me and why COVID? Why COVID as a whole?
Yeah. I don't know. I think for me, it's easier to ask why them, you know, why, when you see a tragedy in someone's life, why them? I don't so much, I guess, because of different life circumstances. With COVID, I never asked the question, why me? It was more of, what am I, you know, what am I going to do with this? I was never angry about it because I was fortunate to have my health back. But I think it goes to further of, for me personally, if you go through a hard time, if I go through a hard time, or if I experience someone going through a really tough time, loss of a child, loss of a parent, it's more of, without faith, I don't know how you get through it. And so that's kind of how I approach things, as hard as it can be. But for COVID, for me, it's not asking why me so much as it is, what can I do with this? And, you know, I feel like, why me? I don't know. Maybe I got it early. Not that I was given to it by God, because I don't think God gave us any COVID, but I think that, what can I do with it? And I chose to give back through my plasma donations. And if I look back on meaning, for me, that was it, and maybe be able to empathize with those who have it. You know, my nephew and I were talking yesterday about just giving back, and it's, you know, he made a comment as he goes, "Gosh, Aunt Conky, you know, a part of you has been added to join someone else's health profile." And a quote, that's amazing to think about. It's mind blowing, really. And science is just is amazing, but yeah. So
thanks. Laddie, I'm aware you have to go. I'm really want to hear Dr. Sloan's answer, but I want to give Laddie a chance to excuse himself because I know you have Bible study to get to in 3 minutes. But I wanted to.
Let me hang on to listen to Dr. Sloan.
Okay. Dr. Sloan, the floor is yours.
I think I'm the merge between Laddie and Constance. You know, I believe it's important on a spiritual level for it to be okay as humans to be able to ask the question of why. Sometimes our faith, specifically the religiosity of our faith, makes us tend to shy away, that we shouldn't ask those types of questions of our God. And I believe that I serve a God that has all power. So do I believe that he may have created this to devastate the world and, decrease the population or whatever else? I don't know. And I don't know if there's an answer that any of us will ever have for that. But the fact that I can at least ask that question, I think I have a loving God that is not angry at me to ask that question. I think it lends towards science to ask those types of questions. It gives thought-provoking moments of clarity in our spirituality and our walk of life. It lends to our learning how to become more faithful and stronger, and or it challenges people to have some type of awakening to what they do believe and who they really are spiritually. So this may be a call, if you will, to all of us as humanity to say, why was this at this point in our life, at this time, what we had to go through as a population together? And the why is important in your faith walk, in your spirituality. The fact that we can even ask.
Mm-hmm.
Cyrus, if I could add to that, thank you. That was good. Just helped me out a lot there. But the one thing that I was given the book Finding Meaning by David Kessler, and it's a study of the meanings of death or life. And Dr. Kessler has Finding Meaning in the loss is really powerful. And so it's called Finding Meaning. Dr. David Kessler, if anyone's interested in that.
Thank you.
Thank you.
And Laddie,
Yeah.
I'm wondering, I know you gotta go, but I'm wondering, I think we have a couple bonus questions that'll be for after you leave, but to close our designated time, could you lead us just in a short prayer?
Yeah. Let us pray. We come before your presence in the awareness that you hear us. We understand that we need help beyond ourselves. So we look out to you for that help, and we thank you for privileges like these and times like these to learn, to expose ourselves, and to learn from others. We thank you for the gift of community. We thank you for allowing us to be a part of the communities we belong to and the kind of calling that you have placed us in to reach out to others, to do things on the behalf of others, to help others. I ask that you continue to bless ISH, the leadership there, and the purpose of their calling. And each one listening, I pray you touch us with your goodness, with your mercy and your kindness. Now may your peace, your love, and your grace be our gift now and always. It is in your most holy and precious name we pray. Amen.
Amen.
Wow. Amen. Thank you, Laddie. And have a wonderful Bible study.
Thank you so very much. Thank you. Have a good night, everyone. Thank you.
Mm-hmm.
Thank you all. Thank you.
Dr. Sloan, if you're willing to hang on for a moment, we have a question from Asia. I hope I'm pronouncing it correctly. Up and coming medical student. So do you see the question in the chat? Oh, here, I can ask it to you. Actually, Asa, if you're here, you're welcome to unmute yourself and ask directly.
Yes, hi. So my name is Asia, by the way. But I just wanted to say thank you, Dr. Sloan and Constance, for speaking today. This came at a really perfect timing for me. But I'm starting medical school soon, and I'm also exploring spirituality and faith and religion, because I haven't been as much, I guess, devoted. But I was wondering how your faith shaped your medical training. or vice versa?
It was the foundation. I definitely grew up in the church, that kind of thing, but there was more to my spirituality than just church and religion. And so with that calling of service to people, and helping and healing, that kind of thing, they go hand in hand. And I mean, that's exactly why I love the Institute and what they do, because I don't believe you can have the medical side of what you about the spiritual understanding and respect of human beings. And so it lends to everything I do from my personal life to definitely my professional life, but it enhances it. If anything, it gives you a foundation, but then it takes it to another level. Because if you can identify with a patient on a spiritual level, there's a different relationship between the two of you as a patient and physician relationship. So I would say definitely stay grounded. I think my spirituality has helped through my training, which was, a lot. And then it has helped in practice and in life. Yeah. So it's the core, it's the foundation.
Thank you so much. Everything you guys said today was just very beautiful and really emotional. So thank you.
You're welcome. You're welcome.
If I could add to that, and your training, I also trained at Ben Taub. Your training brings out your spiritual side. It can awaken it as well. As if you don't start with it, it will. If you're not touched by what you see and don't feel that you want to connect with people and have empathy with them and help them through their trying time, it's probably not the profession for you, I would say.
Correct.
But you'll be pleasantly surprised because you'll have so many opportunities to give of yourself and connect. It's lovely. You're gonna love it.
You will.
Jana, there's a question for you about how to purchase the yoga spiritual cards that Constance was talking about.
Oh, thank you so much. So you can find them on my website. I'll put it in the chat room. Okay. Yeah, sell them on my website. This is what the deck looks like. Thank you, Constance, for sharing that. So yeah, this is the deck. We're both holding it up. It's a prayer card deck that's 40 prayer cards that really integrate mind, body, and spirit, mostly from a Christian perspective, but I also wrote them from a spiritual place as well, so that we could use them in interspiritual settings. And I'm just so honored, Constance, that you found them to be useful, and so deeply grateful while you were, recovering from that horrible time, and I remember us talking and you were just saying, I can't be at yoga mass. This is really hard on me right now. But just the fact that you stayed so deeply faithful, and you were so able to just be present to what was happening with you, holistically, the whole self, your whole person. You were so able to stay focused on your healing. And then what could come out of that? It's just so beautiful. I love to see how we can transform, right? We can take tragedy and then and trauma and turn it into something that can become a gift for others. And you did that. And so I really appreciate, you sharing your story. And all of you, your stories were amazing. So I'm going to put in here my website. It's jennadavis.org. And then you can just look it up there, and the prayer cards are on there. So thank you. Yeah, I would love to share them with you.
Thanks, Jenna.
It was just a beautiful evening. I had tears in my eyes throughout your talks, just hearing your stories and how deeply engaged you were, with all the suffering, and just willing to keep going back in there, from wherever you are, and you just met everyone and right where they were. So it was so beautiful. Thank you.
Thank you.
Thank you, Jenna. It's been such a communal evening, the interconnections people related to ISH in various ways, and sharing of certain kinds of experiences and practices. So as Laddie prayed, I'm feeling a strong sense of community, which, we're zoomed out, and at the same time, I think we've maybe gained over time almost like a skill of leaning into these kinds of meetings and seeing that even though we're not in each other's physical presence, we know that we can feel each other's presence in this kind of space. So just I'm hopeful for humanity. As I said at the beginning, I think it's been a time of great loss, and I speak to any kind of benefit of this time humbly, knowing that I haven't suffered the same things that others have. But I am hopeful that the challenges and opportunities alike, the ways of seeing things fresh and new and differently, that we will move forward as little communities like this and as humanity at large in a way that is hopeful, in a way that seeks to foster and point to the connection amidst disconnection, to hope for trust and look for trust amidst mistrust, and to seek to be trustworthy for others, and to find the growth in pain and trauma, and to have our eyes set in that direction, and to encourage one another to do it together. So thank you so much, Constance and Dr. Sloan, for your friendship of the Institute, of me, and of sharing of yourself tonight. Thank you all so much for being here, and for your own story that you didn't tell tonight, but that you certainly have. And may you be blessed as you continue to walk out in the world, and be well. Keep in touch.